And then it will bring tears to my eyes because it's like, oh my God, we're doing such great things in terms of like being able to share this kind of information so that women can really choose powerfully. For those watching, we want to also acknowledge that this conversation might be a little triggering, especially if you're trying to conceive and you're like, oh my gosh, I'm not even close to being there yet. So feel free to scroll away. And this is here for you when you need, when the time is right. And it's an important conversation. So if you're able to sit with it, this is so important because I'll tell you a little bit about myself. When I went through my fertility struggle, and by the time I finally got pregnant, where I was like, you know what? I have no idea this is going to turn out. So I'm not even going to like really acknowledge it. Like I wasn't negative, but I wasn't like super embracing of the idea of birthing. And so what happened was I was in the fertility clinic. And at that time, back in the day, I was there for 15 weeks. So by the time they graduated me, I'm like, oh my gosh, like you're kind of like stuck in this vortex. So I didn't even have a choice in the matter. Like there was no way. It was too late to get into a midwifery clinic. And I didn't even do any kind of research around it. So I am so super clear that we want to provide and make the choice for you that is right for you, because everyone has the capacity to make their own decisions. And so we want to provide you the right information, and Meganne is going to address that. So thank you for being here. And you have been a midwife, and, you know, we would love to hear your story, but we also have, you know, time to acknowledge. I don't know how long you have. Actually, how long do we have you for?
As long as you need me.
Okay, well, we can't go forever.
So, and for me, Mary, what was like outstanding for me was that when I was finally pregnant, or maybe not so outstanding, but shocking, I had, as you know, I had a subchorionic hematoma. So I was bleeding excessively in my pregnancy. But I was like determined. I'm like, I am not high risk. I am going to get a midwife, because I had been a doula previously and I had seen the difference between having a midwife and an OB. And when you need an OB, it's very helpful because they're amazing at surgery for C-sections. And, you know, there's a various, you know, there's complications. But if you're a low risk pregnancy, having a midwife is amazing. And we're going to hear all about like what that means. And a lot of people don't know that they have an option. Like they think, okay, I went through IVF, or I was in the fertility journey, trying to get pregnant. I'm finally pregnant and I need to go to a high risk, you know, hospital, but that's not the case. So I want to empower people to have the knowledge to know when they can, you know, make the option. And you don't need a referral in Ontario, which is amazing. So you can even meet midwives and kind of interview them and let them know your situation. And Meganne, so what would be some of the cases that you've seen, or tell us, like, why would someone choose a midwife?
Well, one of the main ones is if they're choosing an out of hospital birth, like if they don't see themselves birthing in hospital. So midwives are the only care providers in all of Canada that can offer home birth or birth outside of a hospital. So Toronto and Ottawa also have birth centers. And there is one out of Markham that's a midwifery-led unit as well. But that's one of the bigger options. And one thing that's really important in midwifery is informed choice and making decisions that are right for you, for your family, for your unborn baby, for even children that you already have. And so we go over all the options and we give you all the pros and the cons, and we tell you, what are we going to do with the results of this test? Or what does this look like in your pregnancy? And then people get to kind of make that decision. And that's probably one of the main things that people come to us for, is being a part of their care instead of being cared for.
Yes, I love that. And so tell us, why would someone choose home birth? Like, what is the draw? What are the pros and what are the cons?
So home birth there are a lot of reasons why people choose home birth. Some people have had traumatic experiences in hospitals outside of pregnancy. Some people want to step back from the medical idea of birth. Some people are just more comfortable in their own homes. And we know that labor and birth usually progresses better in your own environment and in an environment that you know. And so that's something that home birth has. My husband would tell you that it's the being able to roll over 3 to 4 hours after birth and go back to sleep together.
That's awesome. It's all about him. Okay, I get it. No, I'm just joking.
No, there's also we would all be able to the midwives leave and you get to be in your own bed and you curl up with your newborn baby and, you're able to sleep in your space instead of like a hospital bed that's, not so comfortable and your partner has to sleep on a bed that's definitely not comfortable. So.
Never mind a chair.
Yeah,
right.
And then there's the happy medium, which for me, I was too petrified to birth at home. And I guess because of the history, right? So like when you come from this history of like, it takes so long and what if there's an emergency? So if you remember showing up to my home, actually you do. And it was amazing. You have a clear memory. And I thought, wow, you're amazing, Meganne, for you to recall my birth. But I was at home until 8 centimeters. And then at that point I got to drive to the hospital because I just had this fear, like, what if something happens? Like, what if I bleed out and I need an emergency or something happens to the baby, right? So I guess maybe that's my own history of trauma, but what are some circumstances where it's not a good idea? What would be the risks of birthing at home?
So there are a few, I guess we call them limitations, or where we would suggest birthing in a hospital. So one of the main ones would be if you'd had a previous C-section. So a few of the recommendations with previous C-sections is being on the monitor and being close to an OR if it were needed, if there were any uterine, oh my goodness, I'm totally blanking on the word. Basically, any complications caused by the previous C-section would be a reason to be in hospital. Other ones would be if there was meconium in the fluid. So if the baby had passed meconium already in the water and your waters broke, having meconium present in the fluid increases the risk of baby needing assistance at the delivery for breathing. And so being in the hospital, we have access to more people that are more skilled in helping with intubation or just helping manage those kinds of situations. We do have equipment that helps with resuscitation of the newborn that we bring to homes. But what if we have time to go into hospital with one of those cases, it makes a lot more sense in that way. Twins, triplets, obviously reasons to be in the hospital. It increases your risk in bleeding. Some people with previous history of postpartum hemorrhages that were quite significant, those are one of the reasons we might recommend being in hospital, just so we have access to that additional layer of care if anything were to happen the next time around. But all of these, as much as we say they're just strong recommendations. If someone says like disagrees with that and they feel very strongly about home birth, we do talk to them about all the risks that could happen, and we talk to them like very thoroughly through the whole pregnancy. But we will come and be with them at home if they do choose something that's kind of outside of the normal. I guess it would be the best way to explain it. But we do come to their home and care for them anyways.
Okay, so then let's bring this back a bit, because Tanya was saying, I had fear, I've had this big history, and, both her and I, we see lots of population of patients that have had, lack of a better word, like trauma through the experience of trying to conceive, right? So the embracing is very difficult. So then there's fear. It's very fear-based. And so the thought of being at home and without the care of like a medicalized thing becomes more fear-inducing, because there's been so much medicalization in the care of trying to conceive. So, speaking to that kind of person, how do we provide them the pros and cons and let them make an informed decision rather than a decision based on fear, right? Because you just mentioned it. It's like, oh, well, wait, you can actually have a midwife care for you, but perhaps not necessarily even in your own home. You can actually birth at the hospital. I don't think some people know this, right? Some people will think, like, if I have a midwife, then I'm just doing at home and that's my only option. And, can I even have a transfer of care? Like, so I think people need to be educated on the process, if that is okay.
Yeah. So midwives, we care for people kind of where they're at. So whether that's at hospital, whether that's at home, And even if I want every drug under the sea, I don't want to feel pain, I want all of that, you can do that. You can have an epidural if you have a midwife. If you end up needing a C-section because you have placenta previa, or we will still be present with you. The OB will be doing the surgery, but we'll be there in the room with you. We still do the care afterwards. We still go and do your home visits. So every birth we know is different. Every story is different. So when we have people come into care, there are some people right off the bat who are like, I want a home birth or I want a hospital birth. And that's their decision. And we do talk to everybody about both options. But there are people that are coming from a place, maybe with a highly medicalized fertility journey. And I've seen both sides. One that's like, I'm very anxious. I want to be in the hospital where if anything were to happen, I'm there already. And then we have people who are the total other side. They're like, I had a really medicalized journey to get to this point. I want to stray away from that. I want to, as much as possible, to stray away from that.
Yes.
And, we want to meet people where they're at that point. And we don't push anyone in either direction. And I think that's what the nice thing about midwifery is, the options, right? Like we give everybody all the options, and there are some that maybe are a little bit higher risk. And we do talk about people, we may not recommend this in your situation, but if it's something that is very strong, that you believe in very strongly, then we'll work with you to reach that goal.
I did not know that. I thought transfer of care was transfer of care. I didn't know that you're still in the picture when the OB is involved. That's awesome.
I know, right? It's amazing.
Did you know
I did. And I love that. And I let patients know because they're afraid, like, what if I need a C-section? Then what? I'm like, you still have the postpartum care. Having a midwife is amazing because from the point of contact in the labor, they stay with you the entire labor. And then the backup midwife comes. So there's two of them. And so you have two people with you from the beginning of that first contact all the way through the end. Whereas with an OB, they kind of are checking in because they've got multiple labors on the go, and you're dealing with a nurse who is supporting the obstetrician gynecologist. So I love that. And then also the component of, even through pregnancy, they're very, A, they're skilled, and B, they spend a lot more time with you at each visit, and very 100%. Holistic, kind of mindset. So I just found that the care was so good. And one of the things you really need when you're birthing is to feel cared for, and that you've had some kind of connection. You're guaranteed to have one of the midwives that you meet. So you already feel like you know somebody. It's kind of like the magical, and it's like you have a doula, but not because she's a skilled midwife and she's focused on keeping you healthy and all the medical side of things. But there's that, that connection you feel, which I loved, made me feel safe.
Yeah, one of the things with midwifery is continuity of care. So so some midwives work in primary models where you only meet one midwife for the whole pregnancy. She's the one that's available for you for your birth and then for postpartum. Majority of midwives work in teams now. So that can vary from like 2 to 4 midwives, and you get to meet all of them mostly equally through the whole pregnancy. So you at least have had a couple points of contact with each midwife of your team. And then whichever one ends up being on call when you go into labor is the one that will come and be with you when you call us. And then we do call a second midwife, like Tanya said earlier, that she will come for the delivery. So what I like to say is you have mama, and then you have mama and baby. So we need, we need two people. We now have 2 clients to care for, not just one. So we have one midwife that's dedicated for the birthing person, and then one midwife that's dedicated for the baby. And then afterwards, we stay for a couple hours after you have your baby, whether it's at home or at the hospital. We stay in the room. We make sure that your immediate postpartum recovery is going well, that you're stable. We make sure that maybe you can go pee on your own before we leave. We make sure you get something to eat because that's very important. And then we do all the paperwork. So that's part of the nice thing, the part of midwives is we have a lot of paperwork to do. So having a doula also involved in the circle of care is great because her or his only job is to support you emotionally and physically. Where we can do that, we have a lot of paperwork to fill out kind of on the side as well. So we can't guarantee 100% of our time is dedicated to you. And then we care for you for 6 weeks after you have a baby.
Okay, that's what's going to be my next question. Yeah, that's awesome.
It is so wonderful.
Like, like I said, when I literally got graduated from the fertility clinic at 15 weeks, and it was like too late. It's like, so let's speak to this. When does a person, when should they call on a midwife? Because don't forget, like if you've had a fertility journey, it's like you're already hesitant, right? Like it's like, oh, I don't even know if it's okay to call. But then I don't want people to be caught in a place where, oh my gosh, now I have no one to turn to anyway.
So we joke around, you find out you're pregnant, you tell us before you tell your partner.
Right.
So as soon as you find out that you're pregnant, fill out the intake form. If you find out maybe this pregnancy was not meant to go to term, then, let us know, right? We'd much rather you fill out an intake form and get put on the list and possibly get a spot, as opposed to come back later and be like really that we regret that we can't find a spot for you. But don't be afraid to fill out an intake form, even if you think it's too late, because there are situations where we find more space, right? That spaces open up, and whether it's another midwife who's joined our practice, and she's looking for people that are due in only a couple months, we can fill those spots in because we do have wait lists.
If you are like me and you had the history of the miscarriages, I would suggest, if it's hard for you to do that, then maybe call when you had your first dating ultrasound around 7 weeks, and then you're kind of know, okay, there's a heartbeat, and then call it in at that point. That's what I did. So that might help. But I mean, if you get that first pregnancy test and then you're like excited and there's no history of that, and I think it makes sense to try to get on the list so that you can have the option for the midwife.
And so when you're saying call, I mean, people maybe they don't know, just kind of like, where do I get it? Who should I see? So with midwifery, there's also collectives. Can you speak to that? Like there's different regions, different hospital affiliations, just to give people an overview.
Yeah, so almost every community has kind of their midwifery clinic, and we have limitations like geographically, where we shouldn't take clients outside of that geographical location. Obviously, there are some exceptions. If we've had someone in care who lived in our area and then moved outside of care, we're not going to, like within reason, like if she moves 6 hours away, we can't exactly care for her at that point. With the knowledge that they do have, if they're planning a hospital birth, they do have to come to our affiliated hospital. So here in York Region, we're affiliated with the South Lake Hospital. Family Care Midwives in Vaughan is affiliated with the New Cordalucci Hospital. Markham Stouffville Midwives is also obviously with Markham Stouffville, Uxbridge with Markham Stouffville as well. So these are the ones around here that I know that are affiliated with specific hospitals. So sometimes we have people that come into our care, but decide they want to deliver at another hospital. We can't provide care at another hospital. So you would either have to choose to come to our hospital or choose to see if you can get care with the midwifery clinic associated to that hospital.
Right.
So Ontario Midwives, right? .com they can go to.
Yeah, if you go to the Ontario Midwives, you can go to find a midwife, and then you can put in your location, or you can put in I'm not sure if it's based on hospital, but your location, and it will come up with the closest clinics to you. And then you can either go to their websites. I know that on our website, we have the map of where our lines are drawn as to who we can care for. But if you're not sure, you can always call. So our secretary can check for that. We also, I think our map might be interactive, and you can actually put your postal code in, and it will tell you if you're in our location.
That's great. And because in Toronto, there's going to be some overlap between different midwife collectives, right? So that can get confusing. And I know for sure some people will put their names on multiple lists as a strategy, and just to ensure that they get in, which is not a bad strategy.
No, it's not. And we recommend even in this area, because there is a little bit of overlap, like between Family Care and Vaughan and us in Newmarket and Uxbridge and Markham. There is, like, if you live kind of Stouffville area, you've got your choice.
Yes, right. Yeah, yeah.
And Meganne, you had 3 children, or you have 3 children, and they were all birthed at home, and you had midwives. So tell us, like, what did you love about having a midwife yourself?
It's hard because my situation is a little bit different, where I didn't necessarily have the like half-hour long appointments. I didn't necessarily need those big discussion topics where, you know, they go over all the pros and the cons with me. I loved being able to know they were there all the time. So even if I had questions, I had weird questions, I knew that I could reach out to them. If it was non-urgent, I could send them an email, or I could call the office and leave a message and be like, hey, weird question, and send it out. And I knew they would answer me when they could. Or when I...
Hey, wait. I have to know now. Like, hello, what's a weird question? What constitutes a weird question? You have to tell us, hello. Because we're all women and we all have weird questions. And so let's just normalize things, right?
Like things like, if my baby has hiccups 10 times a day, is that a bad thing? Right? Like people worry about having too many hiccups, or I've had my baby moves too much. Is there such a thing as the baby moving too often? And it's not necessarily a weird question, but it's, you know, it's a question that people are kind of like, is this an okay question to ask? Like, should I know this? And like, that's what I like about midwives, because we are your care providers. We are like, we do care for you, but we have the time to answer all of those questions, right? We don't, there's no, like, we have usually about half an hour for every appointment. Yes, there are things that, you know, we have to listen to the baby's heart rate. We got to do your blood pressure. And we have some discussion topics that we talk about, but I find I will write out a list of like, okay, you're 28 weeks. We'll usually talk about fetal movement. We'll usually talk about maybe starting to prepare for home birth versus hospital birth, but they come and they have their own set of questions. And I find we kind of either end up being on the same page, or we talk about subjects that we'll talk about that I would have planned to talk about next time, and we just switch it up, right? Like there's no schedule, but I think I like that about midwifery, that they can bring these questions and we answer them then, not, oh, you know, we'll talk about that at your next appointment.
Yeah, these are human emotions, human thoughts, and I think it's really great to be able to address all the concerns and fears, which makes it for a better, relaxed birthing experience too, because, you know, in medicalized care, there's just less opportunity and the inability when there's such high volume to have access to that kind of care, that level of care. So thank you for addressing that. I think it's so important. And so thank you for being willing to share your crazy questions, which I don't think is crazy at all. I think it's to be human.
Yeah.
And do you get...
Oh, sorry, go ahead. There you go.
Oh, sorry. I don't like to interrupt. I want to hear what you have to say.
Oh, I was just going to say, like, there's really, like, everyone says there's no such thing as a stupid question, and there isn't. Like, I think that's what we, like, I feel like that's, if there's anything I want to get across, is bring them, and I always tell people, write down your questions. Placenta brain is real. Baby brain is real.
Right. Yes,
I agree. Placenta brain, because the placenta filters the good stuff and the bad stuff, and all your good ideas are going to the baby, and you keep all the bad ones. So write them down, because you will forget them, and then you'll, you know, remember them the second you walk out the door. So, you know, people come with their papers or their phones with, you know, 5 or 6 questions, and we find that sometimes we'll just open this dialogue and half the questions are answered rather quickly.
I loved the postpartum time, because I also had, like, you know, postpartum baby brain where you're not really thinking straight either. And I had a lot of postpartum anxiety looking back, like, worried my baby's, you know, was going to lose his heartbeat. Like, how could I use that Angel Care monitor? Don't ever recommend it. But I loved having you guys there to kind of just say, baby's fine. Baby's growing, and coming in to weigh him and just be like, you're doing amazing. And like keeping track of the poos and the pees, and like so basic stuff, but it's so important. And you made it feel so like, you're like, congratulations, you're doing great with your breastfeeding. It just really motivated me to keep going. And the ability to have my stitches removed early too, because if you have an OB and you've had stitches because you've teared mildly or moderately or more, you have to wait till 6 weeks to have them removed. And I remember feeling it was so irritating, and it was a big deal. And having Usha at the time remove my stitches, I thought that was great. And having that ability to have somebody come to your home postpartum was like so important to me.
And that's certainly definitely not part of the normal care. And so let's recap. I mean, basically, if you have a midwife, you can start the care from 10 weeks of pregnancy through labor and birth and delivery, and then postpartum for 6 weeks of the baby's life being entered to this universe. So it's like, hello, kind of sounds like no-brainer to me. But that said, we have to go back to the concerns, the real concerns. It's like, well, perhaps I want some technology there just in case. Or what if I have gestational diabetes? What if I have preeclampsia? Then what? What does my midwife do? Or, do I transfer of care then? Like, share with us what happens.
Sure. I just want to touch one thing. So not all stitches need to be removed.
That was just so irritating.
Usually,
it just absorbs.
Great on their own, but some do, and not
right.
still have to do it. So, what your care looks like if you do become slightly more high risk? That's a question that we do get quite often, and you don't lose us. So we offer all the same tests, all the same ultrasounds that your OB or family doctor would. And we interpret them the same way. So if you have your gestational diabetes, sugar tests come back elevated, and it means that you have gestational diabetes, you can stay in midwifery care as long as you don't need insulin or any medication to help control your sugar. So if you're diet controlled, you stay under midwifery care. But if you end up needing insulin, you will be followed by the diabetes clinic of your hospital. And then what we do is we'll send you over to the OB of your choice, and you will have some appointments with them. You keep your appointments with us. We still talk to you. We still spend that like half an hour talking about what to expect with labor and birth, adjusted to the fact that you have gestational diabetes. And if you end up needing to be induced, or you end up, going into labor spontaneously, you still call us, we still come. And we almost become more of a doula role in that case.
Oh my gosh, I didn't know this.
and then what happens is we will then become the baby midwife for that delivery, because the OB will do the delivery, and then we will do the side where the second midwife usually did.
That's amazing.
And then usually as soon as the baby's out, your care is transferred back to us. And then you may or may not have one appointment with the OB at the 6 week mark, but you still have us for the whole 6 weeks.
Oh my gosh. So really, I mean, everyone needs to listen, watch this episode so that they really get the informed choice, because to me, it's a bit of a no-brainer. And like I've heard, I know a lot of reproductive endocrinologists, and, there's going to be a lot of naysaying around midwifery, and unfortunately still. So it's like, it's primary care, and deserving the attention and for not just the midwives, but certainly for all the women and couples going through, to have that informed choice, because most people don't have access to care.
What I loved was when I was a doula, and I attended in the last couple of years. I don't do it anymore. It's like random once in a while, but I attended a labor as a doula, and I showed up, and I was with the midwife, and who left the room temporarily while I was with the patient who's stable. And she was attending to another labor because the OB was overwhelmed by a number of labors. And so she was helping the OB. And then later in this woman's labor, the OB came into the room because we needed a second opinion on her birthing. So they do work really well together. So although maybe, like, as you're suggesting, Mary, that, an RE, like a reproductive endocrinologist, is like 100% go to an OB. I don't know if that's the case. Meganne, can you comment?
I think it depends on the community you go into. Okay. So I've had some, even just friends of mine who have said, oh, my family doctor suggests I go with an OB. They think that would be my better plan. And then others were like, oh yeah, my family doctor said I should find a midwife. That 100%, that's how I ended up in your care, is because my family doctor said I should find a midwife. And so it very much depends on who is caring for you or who is in your circle before you end up here. I think that's a lot of people are like, oh, my sister had a midwife, I had to come get a midwife. We rarely get I think I get 1 or 2 a year. It's like, oh, I Googled care providers for pregnancy and midwife came up, so I picked you. I rarely do I have that. I have a lot of oh, it was suggested to me to try a midwife, or my cousin in BC had a midwife and said I should try to get a midwife here. I think that's what's really lovely about it, because it's a lot of the same. It's been that way for centuries of the midwife in the city next, or the little town next door. The neighbor goes in his horse and buggy to go and get her. Right? That's how word of mouth and connections kind of happen. It's fun, and it's also the people you trust, right? You wouldn't necessarily trust your enemy with information. So if your enemy were to say, go with the midwife, you might be like, I don't know if I want a midwife. But your physician, maybe that you trust, who's cared for you for your entire life, may say, I think an OB would be a better care for you. You don't usually tend to question that. And that's okay, right? There's OBs, 100% have their spot in obstetric care, and we rely heavily on them for a lot of things. And I think we have to appreciate that as well, right? They come in when we need them. And I have no fear of if anything were to happen in the hospital, if I needed help, they would be at my door helping out.
That's awesome. So then let's compare, because, obviously we know the benefits of a home birth. And then let's compare birthing center versus hospital.
So that one's a little bit harder. I've never worked in a birthing center.
Oh, sorry.
But we call it the middle ground. So it's getting the environment of a home birth with the kind of safety net of a hospital birth. So you would still need to transfer out of a birthing center if you wanted an epidural or if you needed oxytocin. So the same reasons you would usually transfer out of a home birth, you would have to transfer out of a birthing center to a hospital as well. Right.
So I guess it's more the feel of not being at a hospital, but some people just don't like being at home, right? So, and maybe more access to things at a birthing center, more, I don't know.
So birthing center rooms, from what I've seen, they have queen size beds. They have huge jacuzzi tubs that you can labor in. They have, the squat bars. They have they have a lot more of those tools and stuff that maybe you wouldn't have in your house, right, handy. And so I think that's a little bit of a benefit too, is maybe you live in a tiny townhome with, one of those tiny bathtubs and you're 6 feet tall and can't fit in those bathtubs, but you want to labor in water. Mm-hmm. Being able to go into a birth center that has these huge birth pools is definitely a great option. You can get the blow up pools, but in a townhome where you can find, it's harder to find space for those kinds of things. And so I think that's one of the things that do push people towards maybe doing the birth center, or it's kind of the first step towards going for a home birth, right? Your first baby, you do have some anxieties around birth and what it'll look like to you, but going to that birth center gives you kind of that medium ground. And then if you have a successful birth center birth the first time, maybe you'll feel more comfortable staying at home for your second or your third, or, some people find that step process a little bit easier to manage, I guess, emotionally.
That makes sense. Although at Sunnybrook Hospital, the birthing room, it's like a giant hotel room. They have a jacuzzi bathtub. It was actually quite phenomenal. Now, you spoke to this, and I think this is very important. Why would someone choose water birth or not water birth?
Well, in my personal situation, let's talk.
Okay, let's talk about you.
Let's talk about me. So I've had 3 home births, all of them land births is what I call them, land births.
Yes, exactly.
More so, my husband was freaked out by water birth. And that was one of the, like, I took his feelings into consideration in this. We watched The Backup Plan. It's a movie with, I think, Jennifer Lopez, and she like has a baby and they attend this home birth, but they have like jump circle, and then she ends up fainting into the birth pool.
Oh, like, yeah. I did see that. I saw that, yes.
And we watched that like early on in our relationship, and he was kind of like, okay, all right. And I was like, it's not always like that. I've had I used to have glasses. I had my glasses fall in a birth pool after the birth. And yeah, that was fun. But water, and we know this like as people with uteruses that have periods, cramping, when you're uncomfortable, a lot of people will go into that warm bath and that warm shower for comfort. And that's what a lot of people find with labor is the hydrotherapy actually really, really helps with contraction pain. And so being in that warm space. And then another thing is baby's in a water element. So you're going from water to water. So that makes the transition a little bit easier on the baby because you're going from a water environment to another water environment and then being brought up to air and right onto your mom's chest, right onto your parents' chest. Like it's warm. You don't know any different, right? So some people find that is one of the reasons they choose water.
So then let's ask you another personal question. If your husband was not freaked out by that movie, would you have considered a water birth?
I think I would have considered it, but 2 out of 3 of my labors, I refused to be in water. I tried a bath with my first, I tried getting into the bath and I lasted, I think, 30 seconds. Right. Not at all. With my second, I tried getting into a shower and same thing. I think I lasted 1 contraction. I was like, this is not for me. With my third, I spent the entire 2 hours of my labor immobile in my bathtub. And then, my first instinct was as soon as I felt like I had to push was to get out of the tub. Right. And so maybe and I also have one of those little commercial tubs. I don't have a large tub. So, maybe if I'd had the space to deliver there, I might have considered it, but it never really crossed my mind. It wasn't my first instinct was to stay in water. It was to get out of the tub and get comfortable on my bed. And so I love how you basically are saying that it's like you trust yourself, you trust your gut and what your body wants, and you listen to that and own it. Yeah. And certainly there are people who are planning water births and they have a tub and they end up still doing a land birth anyway. Yeah. And if I might add in, I don't know if you know who Raven Lang is, but she's very well known and she's in the US and she's like, we're land mammals. We should do it on land. And she's like, she teaches a lot of midwives. So it's very fascinating. And she's like, it's only the younger people that do birthing in water.
I thought in my dreamland that's what I wanted, like a water birth. And, but I didn't end up renting a pool. And in my labor, I wouldn't have had the time, nor did I want water. So it's fascinating how you have this idea in your head, but it doesn't always go. And I've had someone rent the birth pool. The birth pool was filled to the point where we had to use soup pots to boil water on the stove to be able to finish filling the birth pool. And then she had a land birth. But it's wherever you feel you end up. And I think that's what people are afraid is trusting your instincts, right? Sure. And if your instincts say I want to go with an OB provider, they feel like the best match for you, then great. I'm happy for you that you chose something that works. Yes. For you. And 100%.
something told me I wanted to be with a midwife, but I want to be in hospital and I want the epidural. Awesome. We'll get you the hospital. We'll organize getting an epidural if there's time, right? There's some people don't have time.
Right.
But like we tried, like there are people call them birth plans. I like birth ideas because we know that birth can throw a wrench into anything, and it could be a positive wrench, like having a land birth instead of a water birth. But it could also be negative where, you come in, you're laboring beautifully, and then we find that your baby's coming down breech, right? Instead of head down. Or you come in and you're 10 centimeters and pushing and you wanted that epidural, but we don't have time to get it to you for it to actually work for you, right? So I think that's one thing that's important to me, is knowing that, we try our best to get things to work the way that you originally planned and that you envisioned for yourself, but it's not always possible.
Well, the biggest takeaway is that I had a patient come and we were talking about that, as we get more mature and old, it's like we really get that no matter where you are, what juncture of life you are, we just have no control.
Yeah.
Right? Things get, you head into things, you have no idea. Things turn out, people die, there's so many things. And so even with this birth idea, you can have an idea and then just be able to be flexible.
It's really nice to have the options and to feel empowered, because even if it doesn't go as planned with your birth ideas, you feel empowered the whole way. You don't hold attachment to the plan, which I love the idea, concept, because I used to call it a birth plan. I am totally changing now to birth ideas.
Me too.
And and it makes total sense. Just don't hold attachment to the ideas, because it doesn't always go that way. But to have the options, to have the care, it's so helpful. It's so important, because you do feel more empowered. And with that, for me, I was so much calmer. And you remember my birth to the point where you're like, letting me know, and 10 years later. So thank you so much for reaching out.
I don't know if this is time. So I write down every birth I've ever ended.
Wow. That's so cool.
And I went and found your first.
Wow. That's amazing.
And so I have I write little notes, and I write the time the baby was born, how much they weighed, and I have every single birth I've ever attended.
That's so sweet.
Written down.
Sorry, I'm getting emotional because I'm just thinking about how my first birth, it was so special to me, and I'm crying. Anyway, that's the sweetest thing ever.
Yeah, and I'm sitting with pangs of jealousy.
I'm sorry. Thank you for saying that. It'll stop me from crying. Oh my goodness.
No, not to guilt.
No, I know. No.
It's so beautiful, right? So it's
it really is.
And then it will bring tears to my eyes, because it's oh my God, we're doing such great things in terms of being able to share this kind of information so that women can really choose powerfully. See, we're just going to have a little cry fest, because that's who we are, right? We do this outreach so that people are educated and they really can choose what's best for them. And, whatever happens, that they go into it where there's no regrets. Mm-hmm. And and I don't know why I have to say this, but it's that whole birthing pool, it sounds good, the transition and all that stuff. I just can't get over the head of floating poops on the and
the visual of your glasses falling in. I'm like, oh.
Right?
Oh my goodness.
We gotta end off on a lighter note.
Totally.
Well, it is funny. I recently assisted in the sibling to that baby who my glasses fell into the pool. And I didn't even have to have my hands, because the mom did it entirely on her own. She brought her baby entirely up through the birth pool again, but I kept my distance. I didn't have glasses this time at all either. But sorry, I have a big log gown. So it's and I told her, I remember being at your birth the last time and my glasses fell in, so I'm going to keep my distance this time.
That's funny.
So, it's I don't know, it's part of, maybe I just have a really good memory. I don't remember everyone's birth. I can't say that I do. But there are definitely ones that, change you as a person. And I just remember coming and sitting with Tanya, and we had to have this huge discussion, and we're sitting there and she's on her couch with her dog curled up, and we're having this conversation. And I remember I had a piece of paper and I was writing down the time every time she had a contraction. And I'm talking with Usha, and I'm like, she's contracting every 3 minutes. And you were just sitting there, we're just having this huge discussion. And I think we talked it must have been like a half an hour discussion. It was a huge discussion we were having.
About taking antibiotics, right? For the
it was the antibiotic. Yeah. And then we were like, so we should probably check to see what's going on. You're contracting quite frequently. And you're like, okay. And so you walked up the stairs and checked, and then I remember checking in, looked at Usha, and I was like, she's 8. And Usha's like, what? Yeah. Like, okay, all right, let's get ready. We're going to go to the hospital now. Yeah. So it was like,
this is amazing. And just again, a testament to the service and the care that you provide. And because, when we look at women having fear around birthing, but having that kind of conversation, that casual conversation, allows the wound to be open, allows the natural oxytocin to be released, right? So thank you for sharing this, because again, it's like, wow, to me, it's a no-brainer. But again, everyone has their journey, and hopefully, they'll choose wisely from this discussion. So I really want to thank you. We both want to thank you for taking the time out. And, we always try to have like a 10-minute discussion, but it's looking like 50 minutes, but that's okay. Because I think this is really important.
It's so important.
It's and so speaking of which, for those of you that are watching, you can go back, because we were talking about dispelling fear and embracing the birth orgasmically and easily. So you really need to listen or watch, and perhaps Meganne, if you haven't listened, listen to Stacey McPherson, who is a doula and mother of 7 kids, and she speaks to having easy births and embracing births with love and fun and song. So I think everyone should listen to this one and hers, and the power of pooping. My gosh, we released an episode this week, the scoop on poop, and we're talking about constipation. And certainly there are times where it can be an issue, whether it's trying to conceive when you're on drugs, or you're pregnant and you're constipated, or postpartum. We're talking about counter pressure. Like, there's just so many things that is involved, and like, we women, we carry the burden. Let's say it. And we need to lighten the load with lots of love, lots of care, and lots of information, so that we can serve you the best. Anyway, that's all I have to say.